Welcome everybody. Let's go through this information together, and then we'll have some time for questions at the end. So just a quick reminder, this is for educational purposes only. I'm not diagnosing, treating, or giving anybody medical advice today. And I'm going to share what I'm learning. I'm going to share about my own personal experience with ketamine, and I'm going to share some experiences that I've had with other people with ketamine. A little background on me, for those of you who don't know me. This is actually me with my family, my mom and dad and my sister. I have a brother, but he's not in this picture. He had moved out. And the reason I bring this picture up is because I didn't just read a book about depression, anxiety, trauma, and decide that I want to do this work. I actually came to it through my own journey, through my own process. I've been a nurse practitioner for about 30 years. During this time, I've also been dealing with my own symptoms and my own challenges. But I grew up in a really small town in what appeared to be a fairly normal family. I don't know if you look at this picture and see this looks like a normal family or not. But anyway, we were part of a cult. And it wasn't all bad. It was actually, there were some elements of it, like most cults, that are actually somewhat positive and good. But there was also a lot of brainwashing, conditioning, trauma, violence, mental illness. And so that's just what it was. And so because of that, started to develop some dysfunctional coping skills. It helped me survive. I'm still here, so that's good. But it also started to create some problems for me. And I had a particularly bad episode right before I turned 17, of a violent episode. And 3 weeks after that, I tried to commit suicide. Obviously, I failed. And then I got away from my family. And so I thought I had escaped. I went off to nursing school and put all that craziness behind me. But as any of you who know anything about trauma know, that it's not so easy. Like you could kind of suppress it, push it down, try to run away from it, try to get away from it, but it kind of follows you, because wherever you go, there you are. And I was just finishing nursing school when Prozac came out. And just like everyone else, I thought Prozac was going to be the end all be all for depression, that's the depression, everybody was going to be okay and everybody was going to be good. So I don't think I started on Prozac, maybe it was the first one. And of course, if any of you dealt with depression or PTSD, then you know that a lot of times people end up trying one medicine and then it either doesn't work, and then they add another one. And then before you know it, you're maybe on 2 or 3 different medicines, and you're feeling some better, but you're also having a lot of side effects. So that's pretty much what I did for several decades. And I had talk therapy. I had some advanced other therapies like EMDR and some other types of treatments. But then I was very, what I would say, highly functioning. I was able to work, and my personal relationships were kind of always a little bit confusing. I was fairly highly functioning in that regard, but I was still always kind of struggling. And in about 4 or 5 years ago, I read Michael Pollan's book, How to Change Your Mind. And that was my first exposure to the concept of psychedelics and how they could be used for trauma, for depression, for anxiety. So I went on my own journey, and I actually went to the Netherlands and where psilocybin is legal. And I had a psilocybin experience that was truly transformational. I felt at home in my body and really okay for the first time in my life. I had never experienced that. After that, I was just hell bent on, despite all my issues, I'm very, very stubborn. So I was like, I have to find a way to bring this type of therapy to people, because there's so many people that are struggling with depression, anxiety, PTSD, and they're managing, they're treating their symptoms, but they're not really recovering. And if you know the statistics on PTSD, our success rates with treating that are dismal. Like, I think it's like 20, maybe 23% of people actually get relief and are no longer meet that diagnostic criteria. But anyway, I went on to have a few more macrodose experiences and some microdosing. And then for the first time in my life, I was able to be off of an antidepressant, and I was able to be free of the symptoms of depression. So I have another reason for doing this type of work, and this is my sister. So my sister was 16 months younger than me, and she died at the age of 44 from the impact of trauma, depression, and really side effects from the pharmaceuticals, because she had developed high blood pressure and diabetes as a secondary effect from being on all of the mood stabilizers and antidepressants. I know there are people like my sister, you know, who are still well, my sister's gone, but people who are struggling and really going to the healthcare system for help, are good patients, compliant patients, you know, going to counseling and still struggling. So that's my motivation for doing some of the work that I do. And so here's some statistics, and I think these are underreported, but it's estimated that over 300 million people suffer from depression worldwide. Same number, at least, struggle with PTSD, and 164 million, according to this, struggle from substance abuse. And this was pre-pandemic, and I think the numbers are higher now because of everything that we've been going through in the last couple of years. And then we have a lot of non-adherence to antidepressants, and it's either because people don't like taking a pill every day, or they have side effects, you know, they don't like how they feel. Sometimes people say, it was working, but it's not working anymore, or they feel numb, or they have sexual side effects. And then we have at least 30% of people who are what they call treatment resistant. So treatment resistant depression is you have failed at least 3 different antidepressants and counseling and other therapies. So there are a big percentage of people that fall into that category. And then over 50% of people never really fully recover. So they might have a reduction in symptoms. They might not be suicidal anymore, but they're not really living to their, fullest potential. And, this affects people from all races, all ethnic and socioeconomic backgrounds. But women are 70% more likely than men to experience depression. Young women, especially, are more likely. So, this is a big problem. Despite the fact they keep coming out with more antidepressants, the numbers keep going up. So this is not a problem that's going away anytime soon. And people are looking for other alternatives. There really hasn't been a novel medication approach to depression in over 50 years. So the tricyclic antidepressants came out 50 years ago, and then about 34 years ago, Prozac came out. To the 300 million people who are suffering from depression, and especially the 30% that are treatment resistant, we need to have something better that we can offer. And so that's why I get so excited about the potential use for psychedelics, substances or drugs that can help, or medications that can help with inducing these non-ordinary states of consciousness. And we'll get into what I mean by that. So ketamine it's not new. It was developed in 1962 as a derivative of PCP. And if any of you guys know what PCP, remember angel dust? And the effects of ketamine were first described as dreamlike. And then they also noticed that it had a dissociative effect. So people would feel like they were literally leaving their body. And so it became categorized as a dissociative anesthetic. Early on, there were some weird, some people had some unusual and unpleasant responses to ketamine. So they stopped using it so much with people, and they were using it more with animals. And it still is used widely for animals. I was actually had my dog at the vet the other day, and someone was asking me what kind of work I do, and I mentioned ketamine. She goes, "Oh yeah, we use ketamine here with the dogs and the cats." So it's a pretty prevalent medicine, especially in the veterinary world. In the late 60s and early 70s, during the Vietnam War, what they found is they could give it to soldiers, and they called it the buddy drug, because if your fellow soldier was injured, you could give them ketamine. And the unique thing about ketamine is, unlike other anesthetics, it does not cause any respiratory depression. Most other anesthetics, it will help with the anesthesia, but it also knocks out your breath receptors, so you're not breathing. So people, a lot of times people have surgery and they have to be intubated, right? You have to have a tube down your throat to make sure you breathe. But with ketamine, that doesn't happen. It doesn't cause any respiratory depression. And so that was when it kind of got a little more traction and was used in that way. And then they found out kind of by accident that ketamine can have a benefit for depression. So it's like people who had ketamine for anesthesia came back and said, it's funny, ever since I had that ketamine, I was feeling suicidal, I was really depressed, and now I'm not feeling so depressed. So they started doing a little bit of research on it. And what they found is within 24 hours of a ketamine infusion, it works better than 8 weeks of an antidepressant. So it had this very profound, immediate response. The challenge with ketamine, and we'll talk about this, is that effect is temporary. And so if it's not used in the context of the correct preparation and the correct support afterwards, you're going to feel great, which is awesome. A break from depression, even if it's for 7 days, is a blessing for someone who's been suffering for maybe decades, right? But we want for our patients to have this more sustained result than just, a 7-day break for that. So yeah, the benefits are depression, suicidality, which is this suicidal thoughts, addiction. And this is one that's a little tricky because there are people that abuse ketamine. In the party world, it can be called vitamin K, and it can be abused. It also can be used for end-of-life anxiety, for PTSD, and for general anxiety. But when used in the right context, it can actually help with people who are dealing with addiction, because a lot of times people are using substances because they're depressed or because they're anxious or because they have a history of trauma. So this actually is from the 2017 cover of Time magazine about a surprising new drug that's going to challenge that. So, that's been 5 years ago now. So this is getting some more traction, ketamine. So the most common challenges with ketamine are the cost. It can be $400 to $600 per injection or infusion. It's off-label, so it's legal and it's FDA approved for an anesthetic, but it's not FDA approved for depression. So if you're using it for depression, it's off-label, so insurance doesn't cover it. And without the right preparation and support, the benefits are short-lived. So one advantage that ketamine does have over some of the other psychedelic substances, so when I say that, I'm talking about maybe MDMA, psilocybin, peyote, ayahuasca, a lot of those substances you cannot be on an antidepressant, or it's not ideal to be on an antidepressant. Sometimes people who are seeking those medications for depression really struggle because they can't come off of their antidepressant, or then they go downhill. But ketamine can be used because it works differently in the brain. It's not affecting the serotonin receptors, can be used in combination with most prescription medications, and it's legal. Some of you on the call have had access to psilocybin or ayahuasca, MDMA, and currently those things, other than, psilocybin's legal in a therapeutic setting in Oregon now, but other than that, those things aren't legal. So ketamine is the only one of these that is legal at this time. So let's talk a little bit about the pharmacology of ketamine. It's very complex, and it's paradoxical, and it's dose dependent. I'm going to tell you that, and I'm going to tell you a little bit about how it works, but I'm also going to say that the people who use it all the time say we really don't know how it works. But what we think is that, so glutamate and GABA, glutamate is the main excitatory neurotransmitter in the brain, and at certain doses, ketamine blocks the glutamate. And then the most abundant inhibitory transmitter is GABA. So what we know is that, and I'll show you another slide, that ketamine is affecting the glutamate and the GABA receptors. But the net effect is it radically alters how information travels through the brain. Information is not traveling in the same way that it normally does when you're under the influence of ketamine. And here, I know this is a kind of busy slide, but couple things. So, it shows you at the bottom, if you look at the bottom, you have the psycholytic, the psychedelic, and the transpersonal. And then you look at the sub-anesthetic dosing and the anesthetic dosing. So what I just want you to get from this is that at different doses, ketamine has a different effect. when they're using it for depression and they're using it for that effect, they're usually using the standard is about 0.5 milligram per kilogram. And that's either given intramuscularly, so in the muscle, or it's given intravenously in an IV. It increases the plasticity in the brain, and it also increases something called BDNF, which is brain-derived neurotrophic factor. And we believe that those are two of the reasons why it can have such a positive impact on depression. Now, ketamine is neurotoxic if it's used at higher doses and over an extended period of time. So it's one of those things, like a little bit, the right amount and the right dose for a right period of time seems to have a lot of benefits. And if it's abused, if it's used more frequently, if it's used over a long period of time, it actually can be neurotoxic. So it does have those effects. And then, of course, it causes this non-ordinary state of consciousness, what I'm going to talk to you about in a little bit. So how does it rank for safety? So this is a scale that the blue in this chart is harm to self and black is harm to others. And you see ketamine comes in kind of around the middle. It's below alcohol, below tobacco, below cannabis. Those alcohol, tobacco, and cannabis are all more dangerous. There were 12 deaths associated with ketamine between 1987 and 2020, and those were from recreational users, and only 3 of those were people using ketamine alone. They were all with people using ketamine in conjunction with other things, and the challenge with people using it recreationally is often it's not a pure version of ketamine, but there have been no reported deaths from use of ketamine in a clinical setting. And remember, it was safe enough that they were giving it to soldiers on the battlefield to use on each other. Overall, it's a safe medicine, considering, but of course, there's always contraindication. Of course, if you're pregnant or nursing, wouldn't want to use ketamine. If you have a history of psychosis, if you're in an active addiction, this is a little bit controversial, but if someone is, drinking a 5th of vodka a day, or in that state of an addiction, it's probably not the right time to introduce this. You're probably not going to get the most out of it. Someone who's in active mania, that's another tricky thing. A lot of times people who have PTSD can have almost what looks like bipolar depression because they have a lot of coping skills that can mimic that. So very careful history would be important. It does increase your heart rate and it does increase your blood pressure. So if someone has serious heart disease or they have uncontrolled high blood pressure or tachycardia, something like that, they would not want to be using ketamine. And of course, if you've had a ketamine in the past and you didn't do well with it, you wouldn't want to do it. So I thought this was a very interesting chart. This shows some aspects of psilocybin compared to ketamine and MDMA. And if you look at this, so psilocybin is the red line and ketamine is the green line. The biggest difference between a ketamine experience and a psilocybin experience is the feeling of being disembodied. If you've had a psilocybin experience, with psilocybin, you feel almost heavier and really in your body, and it can actually bring you in your body. Ketamine is very much of a floating out of your body. It really is an out of body type experience for most people. But other than that, and then the other big difference is with psilocybin, you can usually have more visuals, fractals, and those kinds of things, and people don't usually have that with ketamine. All right, so a little bit about the research. Between 1947 and 1970, there were over 1,000 studies looking at ketamine. There have been studies in Mexico, Argentina, Iran, India. The first trial that we had for depression in the US was in 2000, and that was used with a 40-minute IV infusion of 0.5 milligram per kilogram. And so I think someone was asking about that. And that is, I'm not sure if there have been any studies that have, even though it's used clinically, intramuscularly, just because it's easier. Most of the studies have been with a 40-minute IV infusion of 0.5 milligram per kilogram. Now, the thing with most of the studies up to now is they've been more of a biomedical study. So they're just looking at the medical aspects. They're not really looking at the impact of set and setting that we know so has such an important part in the psychedelic world where people are properly prepared for ketamine and properly supported after. Up to 75% of the people have significant improvement. As of 2020, there were 140 studies. 70%, here we go, 70% of those were with IV administration. A third of those people got radically better. Some of them needed a booster. About 30% required more than one treatment. And the protocols that seem to be developing are somewhere between 3 and 6 treatments is usually what people do. I know we had a question about intranasal. There's a product, I think it's called Spravato, that is an intranasal, that is an FDA approved ketamine drug. And the absorption when you use it nasally is about 45%. When you take it orally, it's about 20%. And if you do it subcutaneously, just under the skin, it's 90%. In intramuscular, it's 93%. IV, you're going to get 100% bioavailability of the ketamine. But if you take it orally as a pill, your liver's going to break most of it down. So the effects of the ketamine is you have a change in cognition. So your consciousness changes. You can have some imagery, you can have some altered auditory sensation. You feel like almost rubbery, like you can feel disembodied and almost kind of a rubbery feeling. Most people have a pretty profound sense of euphoria. Not everybody, some people don't, but most people feel pretty good when the ketamine is in their system. There's a sense of ego dissolution. So your sense of separation, your this is me and I'm separate from the world, can dissolve. Many people have described a mystical experience with ketamine and feelings of awe and wonder, a different perception of yourself. Now, of course, there can be some potential negative response to ketamine. There can be some nausea, dizziness. With ego dissolution, it can feel scary. So there can be like, oh, this is really scary. I don't feel like myself right now, some disorientation or confusion. Most people feel a little bit confused. That's why you want to do it in a safe setting. But my experience with it and the people that I've worked with, that's very short-lived. As I mentioned, it's like psychological stress from losing your sense of ego. Most people really like the break from their ego, and it's like a nice vacation from themselves. But some people don't like it. So the default mode network is really where your ego lives. And so typically the brain is taking in information, and as an evolutionary advantage for survival, you filter out a lot of information. And it's just to consider not important because it's not going to help you survive. Ketamine at the right dose, at that psychedelic dose, it turns off that reducing valve. So it really like I said, it's changing the way the information is moving around in your brain. The neuroplasticity, so it's like a reset or a reboot, and the peak of that lasts for about 24 hours. Ketamine, more than any other drug, provides a near-death mystical experience. That might sound scary to some people, or that might sound like a pretty interesting experience to have. But if you can imagine just for a minute, just kind of shut your eyes and imagine what it might feel like to forget who you are. You don't have a name. You can't remember what you learned in school. You can't remember the language you speak. You can't remember your history, who you've loved, who you haven't loved, your fears, your desires, how much money you have. You can't just imagine that all of that's gone, and you're just experiencing this pure sense of like free floating eternity and pure beingness. And so for many people, that's actually quite pleasant, and they like it. And that was my experience, and the people that I've worked with so far, is that it was quite enjoyable, the actual experience. But it is, you definitely have a different experience of yourself. And this is why in this in a good setting, you have people that are there with you to hold your hand, hold your feet, to be with you. So you can kind of float off and know that you're being held either physically and also being held psychologically, emotionally, spiritually while you float off. So people often feel a sense of awe, a transcendence, freedom, sacredness, stillness. It can be a pretty transformational experience. And almost facing our mortality makes us more human in a way. It kind of brings us back to what's real and what's important. And of course, ketamine is not the only way to experience that. People have experienced these non-ordinary states of consciousness through breath work, through prayer, through meditation, through communing with nature, at the birth of a child, or actually being with someone when they die. So it's certainly not the only way to experience it, but it's a way to reliably experience it for a set 30-minute period, if that's what you're looking for. The reason, the way they think it works is it disrupts rigid thought patterns. So when we have thought patterns, especially if there's trauma, those are very deep. Even after the threat or something is long gone, your brain is remembering it and playing that loop over and over and over again. So that's how things can be fine, but in your brain, there's still that anxiety. So this can disrupt that and create an opportunity for some neuroplasticity. And depression is characterized by rigidly pessimistic states, and I don't know if you've experienced that or you've been around with someone like that, but it's like they try, they want to, but they really just can't snap out of it. It's like being entrapped inside their own brain, being stuck inside of a narrative. Shock therapy, the reason that works so well is it would disrupt those rigid thought patterns, and they still do that, and it's still quite effective, but this is a more pleasant way to have that disruption, so that non-ordinary state of consciousness or that near-death type experience or that mystical experience, however you experience, or the dissolving of the ego, you've been trapped in something and you can come out of it. And I'll tell you my personal experience. I would describe it as it was like I had been an actor on a stage my whole life, and I was able to go backstage. And I was able to say, oh, okay, I'm playing that on the stage, but that's not who I am. I'm not as identified with that part and that distance from myself. And it's interesting how a near-death experience can treat someone who's suicidal. Think about that. Because people who are thinking about suicide are, most of the time, people don't want to die, they just want the pain to stop. Right? They think that there's no other way for it to go, so I might as well die because this is hard and it's always going to be this way. So it disrupts that, it interrupts that. And then what can happen is when you have ketamine assisted psychotherapy during that window of neuroplasticity, then you can start to do some rewiring of the brain. And the research holds us up that the rewiring doesn't really happen nearly as effectively without the psychotherapy. So it's not really the drug is creating a disruption. The therapy and the relationship connection needs to be there for you really to start to have this rewiring that needs to happen. And so we talked already about the legalities. Ketamine is legal. It is a Schedule 3 drug. So if you look here at the schedules, Schedule 1 are things that are not legal. So heroin, LSD, psilocybin, unfortunately, still under there. Schedule 2 are things that are legal but highly controlled, like Vicodin. And believe it or not, cocaine is legal. They use it medically. We used to have it I don't know if they still have this in the emergency room, but we would use it to stop nosebleeds in the emergency room. Schedule 3 are medicines with a low potential for dependence. Ketamine fall in that category there. So the protocol normally, if someone is going to do this for depression, is there's a medical intake, there's a screening process, and then there's a therapeutic, like an intake with the therapist. And then there's a commitment to doing at least 3 sessions of either IM or IV. Sometimes people will want to have a sublingual dose, just if they've never experienced other states of consciousness and they're nervous about that, then they can try ketamine sublingual just to feel what that feels like. I was talking to someone earlier today who had done that, and she said it just felt kind of like a dreamy state of being, the sublingual ketamine. I haven't actually given that to anyone yet. That's what some of the protocols are doing. And then, there's a difference between regular therapy and ketamine assisted therapy. And the biggest difference is understanding the impact of non-ordinary states of consciousness and this more mystical aspect of the healing process and how that can play into the treatment protocol. Some therapists enjoy that kind of work and are good at that, and some therapists are not. So, I think it's very important to have one that enjoys that kind of work and is interested in working with you in that way. And then those of you who know me know that I have my program, and one of the things that I do is help prepare people for these types of experiences and then support them after. And now I'm also working with ketamine as a substance in that area. So I'm going to stop my